Well, good morning and good afternoon everyone for joining our call today. My name is Jim Corrigan and I lead our physician office space, and today we really have an exciting agenda for you, so why don't we get to it. Having announcements in the recent weeks that I want to underscore and spend time with you and also introduce you to people who really can give you some great insight here. But before we do all that, I want to make sure that we do take a few minutes and talk about our Simplicity Stimulus Program, as well as we'll have Elizabeth Woodcock, who will bring us an update on the latest in terms of the stimulus funding package that President Obama has introduced, the HITECH Act law, and she'll be giving you some insight into that as well in terms of the impact that it has on healthcare system and obviously all of you. And finally, we'd like to spend just a little bit of time giving you a chance to hear directly from the GE Centricity team that works every day for all of you to make sure that our products, services, and solutions are the highest quality and the most impactful. You know, many of you submitted a lot of questions for this webinar, and I'm really excited that the team will be able to address you directly and be able to really discuss with you the answers to those questions that you pose to us. So what I'd like to do is get started and talk a little bit about the Stimulus Simplicity Program. You know, through many of my conversations, I feel I really gain a great understanding and insight from all of you as being a student of healthcare and really learning. And I also believe that healthcare IT can really provide and help overcome many of the obstacles that we face every single day. There are really two big barriers, though, to healthcare IT adoption. The first is the uncertainty around the future of the products and technologies and standards that are obviously changing quite rapidly today, as well as the funding to cover the capital investment for the critical applications like the Centricity EMR. But our collective commitment to reducing cost, increasing access, and improving healthcare really gets healthy again. And this is why we at GE are so excited about the new Healthy Imagination campaign and our Stimulus Simplicity program, which is really one of the first offerings aimed at accelerating the adoption of healthcare IT, specifically electronic medical records. Healthy Imagination was launched a couple of months back, and it's a $6 billion commitment across the entire General Electric company, focused on improving access, affordability, and quality in healthcare. Really, as part of this commitment, the Stimulus Simplicity Program offers a certification warranty plus 0% financing and deferred payments on our two featured products, the Centricity EMR and the Centricity Practice Solution. So I'd like to spend a little bit of time talking about those two products. The Centricity is an electronic medical record system that has been serving over. It documents the patient encounter, streamlines clinical workflow, has secure exchange clinical information and data exchange with providers and patients, ranging from solo practitioners to some of the most prestigious, complex healthcare delivery organizations in the nation. It's backed by GE's 40 years of revenue cycle expertise in Centricity Practice Solutions, which is the completely integrated clinical financial management solution that helps take care of the whole patient experience, from that first encounter to that final reimbursement. It combines the power of the Centricity EMR with our industry-leading practice management expertise in one complete solution. It provides automated workflow, a rules-based engine, and the business intelligence indicators that all of us need to proactively manage the revenue cycle and practice management components of a successful practice. But we understand, based on yours, and has a solution suite that you can depend on. So what I'd like to talk a little bit about is our warranty. The latest version of the Centricity EMR meets the current CCHIT certification standards, and we want our customers to have the confidence that we will continue to monitor and really use diligent efforts to meet the new certification definitions that are currently in flux. And these are determined, as you know, by the Health and Human Services Secretary. Ensuring our customers have the confidence that GE is standing behind its products and solutions, we've addressed that barrier of uncertainty that many physician practices have around the future product and technology standards. And we are offering the first component of Stimulus Simplicity for these products, our certification warranty to you. This is our commitment in order to ensure that we help support your efforts to demonstrate meaningful use and be eligible for the federal. Key experts are actively engaged in the standard-setting bodies that are working with the government to find meaningful use criteria that Elizabeth will talk about. Under our certification warranty, if the then most current version of Centricity EMR or Centricity Practice Solutions does not meet the federal certification criteria within a specified period, we will credit the standard support services fees up to 6 months. But that's just the beginning. We wanted to also show you how we can partner and help bridge the capital requirements that I talked to you about earlier. So let's talk a little bit about financing. To help address the need for interim funding to cover the capital investment from today to the funding reimbursements of ERA, GE has offered the second component of Stimulus Simplicity, our 0% financing and deferred payment program on our Centricity EMR and Centricity Practice Solutions products. Designed to help you invest today, GE Healthcare and GE Capital in order to make an EMR a meaningful part of your practice. We're offering this interest-free financing that can include the software, hardware, and installation, but will include the monthly maintenance once the system is implemented. In addition, we have also set up a deferred payment plan to help you align payments with the timeline of meeting the meaningful use standards that are being outlined today. So what does that mean for all of you? We expect to ensure that we don't get paid until you get paid. Our team will work with you on the specific timing of those payments. And as Elizabeth will explain in a moment, it is up to you to demonstrate meaningful use. While we are doing our best to align your payment schedule with the meaningful use timeline, you will still be responsible for repaying the loan in the time frames agreed to at the time of purchase. Most importantly, though, this program is available to all practice sizes. Qualification, of course, will be very normal to any other loan that you and I apply for today. So what I'd like to do briefly is show you some of the details of the warranty. Now again, you'll have the opportunity to visit with and work with our commercial teams or go directly to gehealthcare.com/hightech to get more of the details. There's also details in terms of financing. Again, I want to make sure that we share with you the details and the fine print. And this is as fine print as it gets, and we're very, very proud of that in terms of making this program very, very simple and easy to use. So in terms of Stimulus Simplicity, it's really about helping bridge your practice to meaningful use. And I hope you agree, because we are very excited about this offering. It gives you the simplicity, clarity, and affordability to invest today in healthcare IT and have healthcare IT help bridge the gap to make sure that we can do all that we can to not just take advantage of the legislation that's out there, but as I said earlier, really make healthcare here in the United States healthy again, which really leads me into our overall Healthy Imagination program. I believe this is an excellent example of GE's commitment to healthcare. Healthy Imagination is really a unique way of displaying our leadership, leverage, stability, and scale in the market to help work for all of you. You can learn a lot more about Healthy Imagination in healthyimagination.com, but I did want to highlight a few of the key efforts that GE will undertake as part of Healthy Imagination. By 2015, we will invest over $3 billion in research and development to launch over 100 innovations that will lower cost, increase access, and improve quality by 15%. GE also will work with its partners and customers, people just like you, on innovations in 4 critical needs. Target high-tech products to be more affordable in terms of price points, broaden access to the underserved, and most importantly, support consumer-driven healthcare. In addition to offering world-class solutions, that we hope we also give you the confidence in our commitment and certification of the Centricity EMR and Centricity Practice Solutions products. We hope that the offering of Simplicity Stimulus is something that you can really hang your hat on in terms of our commitment. And I hope it reinforces what we all know and believe is that healthcare is our mission. It is the legacy that we want to leave for all of us. But this level of commitment really requires the highest caliber team leading the effort. So I'd like to talk a little bit about the Centricity EMR team. It's really my pleasure to introduce Mike Frigoletto. Mike is the Vice President leading the operations for our Centricity team. he'll be joining here. Mike is accompanied by several members of his team who are working every day to ensure that our customers are successful. And I'm really looking forward to hearing the questions that you've gathered and the answers that Mike and his team have. But before we begin, I'd like to introduce Elizabeth Woodcock to share an update on the latest information on the economic stimulus package. Elizabeth works with practices all across the United States, helping physicians just like you to improve practice operations with an eye toward the impact on revenue cycle and clinical efficacy. So Elizabeth, off to you.
Thank you so much, Jim, and I'm delighted to join you and GE today to talk about the stimulus package. Now, I think the audience would all agree that former President George W. Bush and President Barack Obama may not agree on many issues, but giving every American an electronic medical record is one of them. Despite the fact that Bush, if you remember, made a promise to deliver electronic medical records to Americans in his State of the Union address back in 2006, well, the adoption rate for EMRs, as demonstrated in this table, remains remarkably low. Well, step in February 2009, Obama stimulated the weak economy, facilitating the adoption of EMRs through the American Recovery and Reinvestment Act, ARA, which is also known as the High-Tech Act because of the reference to the section title, Health Information Technology, allows for up to $44,000 per physician to adopt and implement an EMR. The money, which is actually tied to the Medicare program, will be doled out over a 5-year period, and it's actually facilitating. In other words, those physicians who don't implement an EMR will actually suffer from penalties beginning in 2015. Now, physicians who serve a significant Medicaid population, such as those practicing in community health centers, they're actually eligible for up to $63,750. Well, for all of the details, I'm actually going to recommend that you go to the source document yourself, and you'll find the link on this page, as well as on a summary of resources at the end of the slides. The funding is specifically for physicians who demonstrate the use of a qualified electronic health record in a meaningful manner. Now, let's take a few moments to further examine these two operative terms, qualified and meaningful. Unfortunately, there's a lot we don't know about qualified, like who will be the certifying body, which systems will actually qualify. But here's what we do know. A qualified system must include patient demographic and clinical health information and have the capacity to provide clinical decision support, support physician order entry, capture and query information about quality, and exchange health information with and integrate such information from other sources. Now, remember that other important term, meaningful? Well, the Act specified that meaningful use include e-prescribing, connectivity, and submission of quality measures. And furthermore, that the government would provide more direction soon about those criteria. Well, that soon came just a few weeks ago when the draft criteria Office of the National Coordinator for Health Information Technology. And you'll see that link to the June 15 report. And I'd actually strongly encourage you to review the whole matrix of criteria yourself. Well, this proposed criteria generated literally thousands of comments, and it's not surprising why. You'll see a sample of those preliminary criteria for the initial year, 2011, right here on this slide. Some of the criteria were predictable. Well, the reporting of quality measures, for example. It's similar to Medicare's pay-for-performance PQRI program. But expecting a meaningful user to have implemented criteria by 2011 such as CPOE, computerized physician order entry, electronic access for patients to personal health information. These expectations were just way too stringent. I will note again, these are draft criteria, a starting point that is. Revisions are actually planned over the summer, and although we don't have a final outcome, their criteria that were published in this June report are actually important to understand because they're indicative of what the government is considering to establish what is a meaningful user. Now, let's take a look at the payment schedule for the HITECH Act. The payout, as you can see, is tiered. Well, you'll receive the maximum subsidy if you install a qualified EMR. And remember, a certified system, and you've got to be a meaningful user, by 2011 or 2012. And that subsidy is going to decline, the 44 being the maximum, 1,000 as your maximum, and then if you wait until 2014, you're looking at, as you can see, 24,000. As I previously noted, the funding is tied to Medicare. In fact, physicians are actually eligible for a maximum of 75% of their total Medicare allowed charges. As you'll see in this chart, for example, you'll need to bill $24,000 in Medicare charges in 2011, allowed charges, that is, in order to qualify for the $18,000 subsidy. It is notable, however, that these Medicare allowed charges, well, they're actually pretty low, and thus the vast majority of physicians who do accept Medicare patients will qualify for this maximum subsidy. In addition, via a decrease in the Medicare fee schedule, well, penalties, that is, there will be penalties beginning in 2015 to those physicians who aren't on a qualified system and aren't proving themselves to be meaningful users. The penalties will increase over the years with a maximum of 5%. The government does reserve the right to use that 5% if the adoption targets aren't met. Although there are many, many issues surrounding the stimulus package, I'd actually like to take the opportunity to address one important one, and it's probably the most often asked question that I get. And it's this, the fact that hospital-based physicians won't qualify for the funds that we've been discussing. Let's review what we do know. A hospital-based physician who furnishes substantially all of such services in a hospital setting, inpatient and outpatient, and, very importantly, and through the use of the facilities and equipment, including qualified EHRs of the hospital, well, you're not eligible. The Act specifically refers to emergency medicine physicians, anesthesiologists, and pathologists. Now, of course, there's many, many questions about hospital-based physicians, particularly from those physicians who may be owned by a hospital, but perhaps are still office-based. And so allow me to just emphasize this last quote. The determination of whether an eligible professional is a hospital-based eligible professional, and very importantly, as defined by the Secretary. And unfortunately, we haven't gotten clarification as to that. But what we do know as we continue, that it is without regard to any employment or billing arrangement between the eligible professional and any other provider. So it really is focused on the site of service, not the employer. Well, now that we're up to date on the stimulus package, let's actually turn to the question-answer segment of our webinar. Many of you submitted your questions to GE, and I'm delighted to reveal that we have with us key members of the GE Centricity team to answer the most common and pertinent ones. Mike, can you take a moment to introduce the members of your team that are joining us today on the panel?
Is Joanne Kern, who's responsible for our ambulatory EMR product development. Mark Visosky is our service and support leader. And Brandy Fox, who oversees our project management team and is responsible for all of our new customer installations. And as for myself, I have overall responsibility, as Jim had mentioned, for our ambulatory EMR and practice solution offerings.
Mike, thousands of physicians are going to be implementing electronic medical records in the next 18 months. How is GE prepared to handle this dramatic increase in customers? And, well, how can a practice make sure that it won't be lost in the shuffle?
Sure. This is a good question in the context of what we're seeing as a very dynamic marketplace and the perception that there's going to be a gap in EMR implementation expertise in the coming years. So let me let Brandy talk about how we'll manage each implementation in a few minutes, but let me comment on our organization. Today, the implementation team is made up of over 30 individuals, and our experience level is over 7 years with GE implementing EMRs. The team's got a great mix of clinical consultation, project management, and technical expertise with our EMR product. And as a company, of course, GE has over 20 years of implementation experience with EMR systems. So from my point of view, and looking at the Healthy Imagination investment by GE, we're introducing even more resources to this mix as we forecast out demand on implementations. And our commitment is that we will continue to staff appropriately to address any increasing demand. But in addition, we're also investing in clinical content and refining our implementation approach to make them more efficient. We expect those efforts will shorten the overall implementation cycle, but in some cases by nearly half the time as we're seeing, and reduce the total cost.
Sure. I'll just add to what Mike said that the professional services team is not only monitoring and planning for those capacity increases to stay ahead of the projected growth, but we're also continually applying Six Sigma methodology to our processes to increase efficiency. So we're working on a new rapid install option that decreases the overall project timeline, as Mike said, and we've improved tools and methodology that decrease the amount of effort required to build and prepare the system. So we're very committed to supporting the growth in EMR adoption. We have a dedicated project management team that serves as an advocate for managing your entire implementation experience and navigating you through the process as your single point of contact. So really our main goal is for you to benefit from the breadth of GE while never feeling lost in the shuffle.
Thanks so much. Well, 2011 is right around the corner, and many administrators and physicians are asking about the time frame to implement a scheme, about the purchase experienced by your customers.
That's a great question, Elizabeth, and one that I'm definitely hearing from lots of practices right now. It's a really exciting time to be a practice, preparing to use all this new technology in your office workflow, but, at the same time, there still is this lack of real clarity on how the stimulus incentives are actually going to be applied. I hear a lot of practices waiting to really see how some of the incentives might play out when they're in action before they truly commit, which is totally understandable given how the economic climate looks and the uncertainty around the actual execution of the stimulus incentives. But most of the folks that I talk to lately are keenly aware of the fact that they want to make sure they take full advantage of the stimulus dollars for an EMR, which means they need to have their EMR in place and implemented and in full, meaningful use by the end of 2010 if they're focused on qualifying. The penalties or those decreased Medicare payments that you talked about, Elizabeth, will really start to kick in the 2015 time frame. So I'm hearing a lot of practices start to count back from that sort of timeline, saying, okay, if I go ahead and make my decision toward the end of 2009, that gives me the first or second quarter of 2010 to actually implement, and then I should be up and running by around the fall or end of 2010 timeframe.
Right. So let's actually talk a little bit about the actual implementation time frame. Brandy, what do you actually typically see there?
Well, I definitely agree with Joanne's assessment and plan to work backward from an expected go-live date. So as I mentioned before, we have a variety of implementation options to meet really varying customer needs, beginning with a goal of 10 weeks as a baseline, and then we would add more time depending on the additional customization and the training needs that an organization has. It could be 6 months or longer for large and complex enterprises. It will vary for each organization, so what's really important is that the sooner you can get engaged with GE, even during the pre-sales process, for us to understand your organization and goals, the sooner we can provide a more tailored estimate of the timeline for your implementation. So our approach is always to learn about the unique needs of your organization so that we can help make sure you get the right fit. So in order to have the most implementation options available to you, prospective customers really should begin that process now and definitely prior to the end of 2009.
In the questions that were submitted, several administrators revealed that they're anticipating quite a challenge when it comes to implementing an EMR. What type of training does GE offer, and will you be on site with your customers as they implement the electronic medical record?
Yeah, this is such a critical piece of the entire implementation process, and we definitely practice as rightfully very concerned about the impact training will have on their physician productivity. So let me tell you about the types of options we offer in the training itself, but then I'd like to touch base on the other knowledge transfer that is so critical and how we'll partner with you for a complete package. So when it comes to the actual training delivery, we use what we call a blended learning approach to provide the most cost-effective and user-friendly options. So what this means is that you'll have a variety of modes available to receive the training. We have some basic product training that's available via computer-based training modules. Those are self-paced and available to the user 24/7. And then for more advanced topics, we offer training via live, remote, web-based sessions, or we can come on site with the GE resource and your project team. So despite the mode of delivery, we have a dedicated customer education team. They focus on adult learning principles and also have an EMR consultant assigned to work with you on topics like workflow reengineering and change management, and those are on site at your location. So there's so much more to a successful EMR than the product training. Our goal is to provide a complete solution in a variety of ways so your practice can stay productive.
Brandy, you know, in addition to all the great training that is done during the implementation, GE offers many opportunities to take additional training classes to train new employees or to complete a refresher training. These classes are offered online, or we also have staff that can visit the organizations to complete specialized training.
Great, Mark. Now, Joanne, let me ask you a question. As you well know, every specialty is a bit different, not only clinically, but from a workflow perspective. Does Centricity offer one EMR solution for all specialties?
Yeah, great question, Elizabeth. And you're right, specialties are quite a bit different one to the other. But yeah, there actually is one application that gives us a lot of strength. There is a great amount of flexibility with how the system itself is configured or can be configured. So we have customers from all different types of specialties that use Centricity within their settings. Our customers create their own customized documentation templates, order sets, workflows, etc. You know, we're also able to provide some special clinical content in a variety of different specialties, so practices can actually get a bit of a head start within their given specialty as well.
Overwhelmingly, physicians and administrators and staff want to know how user-friendly is the system. Joanne, can you answer that question too?
Yeah, absolutely, and usability is a really key important quality for us as well, and one that we've been putting a lot of focus on in the past and definitely are putting a lot of focus on going into. In fact, just last month we've released a version of our Centricity EMR that allows some easy-to-use viewing access from web browsers or an iPhone. We're getting a lot of really positive feedback on that. You know, we've been privileged to have a large and really active user group who actually partners with us on developing many of our usability designs. So in addition to being originally designed sort of by and for physicians, Centricity continually evolves based on all of this user feedback that we get. We have a great customer collaboration program where our customers join us not only in just focus group type input sessions, but they're also giving us feedback continually into the actual application itself. So we're thrilled to have that input.
Now, all of this helps paint a more complete picture of the products and the process. So we all know that not everyone in a practice is really, well, enthusiastic about changing from established workflows. Can you help a practice manage physicians and staff who may be a little resistant to change?
Well, I'm very excited to talk about this topic because this is really what the EMR is all about. There are so many benefits that come with the implementation experience, but it can also be overwhelming and uncertain. So change management is really the foundation of our entire EMR implementation process. We know and understand the hurdles that come with re-engineering workflows for an electronic chart instead of a paper-based process. So we weave in some very key steps throughout the implementation. So the first one is involving the key stakeholders early in the project. So whether this is C-level resources at a larger practice or a medical director or practice manager at a smaller practice, buy-in from leadership is really critical, and attitude toward change generally cascades from the top. So from day-to-day experts in the process, new workflows need fewer adjustments, and the staff feels more comfortable that their work and issues were taken into consideration. We also identify clinicians with specific interests and skills and involve them in that aspect of the implementation. As those processes are created, it's really all about creating ownership of the project and the application. And we're strongly focused on knowledge transfer so that the project team can feel confident about their ability to answer questions about the application and create new workflows. So this truly builds a sense of shared engagement with the process. And lastly, a very key component is communication. We recommend and will also help you with setting up regular, timely communication to the staff about the process. So the unknown is really what breeds uncertainty. Communicating how decisions are being made, how the EMR is being implemented, with information. So beyond our core methodology, we also have a customer education team that's certified in the Change Acceleration Process, or CAP. And CAP is really a model, a process, and a tool or skill set for increasing acceptance and commitment to changes. So what I'd like you to take away is really that you have an experienced, passionate GE resource team that will be supporting you in managing the change and specifically working with you and any staff you feel need extra attention.
And Elizabeth, what I would add to Brandy's comments are that we know that fear of change and skepticism are natural reactions as they think about, as people think about an EMR implementation. And it's a very natural starting point. And it's why we start out just asking lots of questions and trying to listen to the needs of our customers as we try to build a relationship and partnership with you.
Speaking of asking questions, the most frequent question that I hear from physicians directly and that we received in the input for this webinar is during an EMR implementation, what's the impact on the clinical workflow and the doctor's time?
Yeah, that's a great point, Elizabeth, and I think you heard it loud and clear from Brandy and Mike just a minute ago. There are many practices that are clearly worried about a negative impact on the office workflow, and it's definitely true that implementing an EMR is a big step. It can present many challenges. You know, sometimes it's an easy mistake to let the technology and the workflow start to work against one another instead of truly complementing one another. But as Brandy said earlier, we have a really strong commitment to helping practices work through the change management component of implementation. And one of the reasons we've intentionally tried to keep Centricity EMR so configurable and flexible is so that it can fit. No doubt there's a learning curve when a practice first adopts an EMR, just like any kind of transformational technology. But once those providers get over the initial implementation hump, they can really start to see value not only at the time of care, but on many of those sort of harder to manage aspects of how they care for patients. You know, outcomes management, patient population management, comparative benchmarking, qualifying for all the different pay-for-performance programs. Those are all those types of areas where providers can really start to see exponential value in using an EMR to facilitate their care delivery.
Thank you. Mark, we all know that there's the EMR software, but what types of hardware do practices typically need to buy when they start down the path to EMR implementation?
Elizabeth, this is a question that's really on everyone issues that face this country. We have a bunch of different options that our customers can choose from, but our goal is to make sure that we deliver a standard configuration that will make it easier not only for us to implement the product but also to support it long term. Our product runs on the Microsoft operating system, which is an industry standard and allows for easy support of the product. But it's also important for a lot of our customers to give them options such as Citrix and high availability. These are some of the options that we will work with each of the organizations to ensure that you are making the best decision on your hardware and the long-term health of your organization. Of course, many practices are looking to move to the 64-bit computing platform. Centricity EMR and our latest version of Centricity Practice Solution supports these hardware enhancements and allows the application to scale to meet the needs of even our very largest organizations. We have an expert team of hardware specialists who can help you make these decisions. GE also has an option that will allow us to host your hardware for your organization. This will allow you to concentrate on the use of the product and let us maintain your hardware for you. We have a technical team that will not only guide you to the correct purchase, but will also help you make and build the installation of the hardware. As Jim mentioned earlier, we can work with you to finance this part of the purchase as well. In short, standard configurations that we offer will allow you to have confidence not only in the purchase, but making sure that your purchase will serve your needs for years to come.
Of course, a big question, perhaps even the most significant, that administrators and physicians have is the level of cost savings that they can expect from an EMR.
I guess the way I would answer the question is that you'll see savings and benefits in a variety of areas in your practice. In the short term, our customers will generally realize savings from the cost of maintaining the charts and transcription services. And we have heard of some practices being able to realize some benefits in malpractice insurance premium discounts that are being offered from EMR implementations. One of the features, though, of our EMR is a coding feature which allows you to improve the coding accuracy and get paid correctly and avoid leaving money on the table with your coding of different claims. Our customers have reported a reduction in lost revenues from unbilled services because our EMR is now accurately capturing data that was otherwise lost in the paper records. And the impact of these savings is going to vary from practice to practice based on particular the way the practice operates, but it's not unusual to see thousands of implementation is realized over time as your practice matures and it grows with the EMR. The most potent benefits come when customers are achieving efficiency in the delivery of care. As Joanne touched on earlier, automated workflows can save physician time and staff time that can be invested in seeing more patients. And adding additional patient services, such as necessary immunizations, can be flagged and tracked. And while I've described some savings opportunities, what's the most important for every practice is that they are thinking about and measuring what they want to change up front, so that you don't just get savings from an implementation, they come from the adoption, the utilization, and the measuring for success, all of things that our Centricity EMR can help deliver.
Several billing managers, business office managers, wrote in that they're really concerned about billing and collections. They love their billing system, and they don't want to change it. Can GE interface with other practice management systems, and what if the practice decides to switch? Does GE have a revenue cycle management solution?
Yeah, right, Elizabeth. I mean, it totally makes sense for a practice to want to keep their existing practice management system if they're really happy with it. Our Centricity EMR integrates with many different PM systems, and with over 20 years installing EMRs that Jim mentioned earlier in a wide variety of different specialties and settings, and roughly 30,000 clinician users across our hundreds of different sites, we've interfaced with just about the majority of all practice management systems out there. If, however, we find our customers, if they happen to find that their existing practice management system isn't really all that they want it to be, or it hasn't grown with your practice, we also have revenue cycle solutions that fit both larger and smaller practices. Our Centricity Practice Solution product that we talked about earlier is actually a fully integrated EMR with a practice management integrate with our standalone Centricity EMR product, or that can operate independent of an EMR. GE has a long history in robust revenue cycle solutions. We recognize that part of running a practice these days is actually running a business, and Centricity can really bring those two aspects of the practice together.
Well, we've talked about cost and collections. Are there other revenue opportunities that your customers have realized?
Elizabeth, I think it's important when considering this question that you think about the goals for your practice and your area of care, because every situation is different. As I mentioned earlier, our practices routinely report increases in reimbursements from coding accuracy and transparency that they can realize soon after the implementation. But in addition, there's incentive payments through PQRI reporting, and of course the stimulus incentive payments that you covered earlier can amount to new revenues that can be considered for your. We see the most significant source of incremental revenue comes from the optimization of the practice. Very simply, maybe you are able to take a chart room, and with full digitization, you're able now to turn it into a treatment room so you can add more patients to your practice. And of course, as physicians are able to free up their time doing administrative work, that time can be applied to seeing more patients as well during a business day.
Thanks. Well, how does GE support customers? In other words, what can a medical practice expect its relationship with GE to be like? Mark?
Elizabeth, that's a question that I hear from a lot of our customers. To me, customer support is a partnership, and that partnership starts with the implementation and runs through the life of the product. We take a really aggressive approach to our transition from the implementation team, which is Brandy's organization. I really like to think of my team as an extension of your organization. When you have a question about the use of our product, we should be there to help your organization out. We also offer an account management team that's responsible for making sure that we understand the organization's growth plans and how GE can fit in to help out in those areas. GE has one support organization that will work with you on supporting both the EMR and the practice management sides of your business. As I look, I'm able to look at many different metrics, such as the time it takes for my team to resolve issues, how long it takes to respond to the customer's request. But really, the most important one is our customer satisfaction survey. We send out surveys to our customers as a case is closed. These surveys help me gauge how GE met your needs with supporting your issue. The GE team all has a goal to be best in class. We also work very closely with the independent user group to provide ongoing training and to get their inputs on how our products so that together we can help you get the most of our products.
Earlier in the webinar, I went over these draft definitions of meaningful use, the ones that were released in mid-June. The proposed criteria require electronic access for patients to their medical records. Can GE system help facilitate this requirement?
Yeah, that's a great, point, Elizabeth. And meaningful use really is at the top of almost everyone's mind right now, isn't it? It's as these draft definitions are coming to bear, it really is a topic of hot conversation. Let me approach your question from maybe a couple of different angles. First, I'll just touch back on some of the points that you and Jim mentioned earlier, and then let's talk about our talk today. We really feel that the Simplicity program that he mentioned and really many of our other initiatives are helping us put our customers in a really good position for them to meet meaningful use criteria. The Department of Health and Human Services is really looking at these incentives as a way to not only make sure that practices adopt EMRs, but that they truly use them in transformational ways, really, to change the way they deliver care. And Brandy, as you mentioned earlier, there's a big change management component to that as well. Between our advanced components around electronic prescribing, quality outcomes measurement and reporting, and community-wide health information exchange tools, as well as the patient tools, which I'll talk about here in a second, we feel that we're delivering customers really a suite of solutions that gives you the tools that you really need to measure, report, and demonstrate quality. We're really excited about this push to use information technology to help providers truly engage with patients in a meaningful way before, during, after the encounter. We all know that as hard as we try to perform great patient education during the patient's visit, and we try to make sure we've answered all their questions and communicated all the pertinent information to them, patients really can only absorb so much information at the end of the day, and there's still some gaps that happen. Sometimes they think of new questions once they get home, or we have new results that we need to tell patients about. Sometimes patients have questions that come up before they even come into the office. So with our patient portal products, practices actually get a fast and convenient tool set that allows them to provide their patients with online access to things like appointment requests, prescription renewals, new results or reports, and also able to ask general questions as well as any billing and demographics. It's hard enough to be a patient sometimes, and for practices to manage the various different ways that patients want to communicate. And we really see these online tools as a great way for those practices to be more efficient in their own workflow and still give the patient a truly personal and positive experience with the practice itself.
Joanne, you just mentioned something very, very important, information exchange. One of the priorities stated by the committee that drafted those meaningful use criteria is to, quote, improve population and public health, end quote. With this in mind, does GE have any sort of point-of-care prompts that can be applied to certain populations of patients?
Elizabeth, this is Mike, and yeah, we have invested quite a bit in our decision support and care management capabilities, and prompts are a good example of the convergence of these two goals. So by assigning a care prompt, by example, to a set of patients with a specific condition or a set of conditions or a certain assessment result, we can help providers in the delivery of care, because we allow you to practically know when patients fall into a category and need additional screening or treatment. It's one of several ways I think that we can use clinical data to proactively reach out to whole groups of patients, and it will continue to evolve.
Mike, can you actually talk a little bit more about connectivity and how GE is working to bring all of this information together?
Sure. Our EMR application is aligned with the interoperability requirements as laid out by CCHIT. But in addition to that, what you may not know is that we also have a very successful and well-established health information exchange solution. And that solution offers interoperability to directly support population and public health reporting use cases. They're the engine behind 3 out of 4 live HIEs that were cited by the HITSP real-life stories that were published earlier this year. And last week, we announced an exciting partnership with ICW to accelerate our expansion into the e-health. And with ICW's expertise in e-health and patient connectivity, we will continue to invest that capability and integrate it with our EMR and our HIE services technology, our patient connectivity and communication tools, to further support our overall solution and interoperability capabilities.
Well, Mike, Joanne, Brandy, and Mark, I'd like to thank you for taking the time to answer these questions today. I know that many of the questions that are on the top of the mind for medical practices around the country right now were addressed today. Well, we've done our best to cover as many of those frequently asked questions in the time we have. Jim.
Thanks, Elizabeth. Thanks, Mike, Joanne, Mark. I hope you all can see that you have a very, very dedicated, insightful, but most importantly, I think a lot of domain from the industry on this team. I want to thank you all for the questions that you sent to us as well. They obviously enabled our team to give you live feedback on items that are of concern to you. And I just want to reaffirm to all of you that our GE team is waiting right now to go into any level of depth with you, the folks on this call or the commercial team that's waiting out there. I want you to know that from GE's perspective, while we have a great amount of scale to leverage, the company's really no bigger than the folks that you heard on this phone, Mike Frigoletto, Joanne Kern, Mark Pisosky, myself, Jim Corrigan, Christina Cusimano. There are so many people that are awaiting our ability to help you take advantage of the Legic View and leverage the insight that we have. Whether it be across the workflow, decision support, ensuring that we deliver our product in a timely manner through our cycle time initiatives, or just the fact that the diversity out there in healthcare delivery organizations is vast. And I think the experience that you have heard here on the phone, plus the many, many people that are working with all of us to provide high quality, high impact, but most importantly, intuitive solutions for all of you to work with to deliver very, very effective healthcare while ensuring that you manage your practices effectively is really the mission that we have out there. Again, I do want to remind you all that there is a team waiting to talk to you right now. There obviously also is a website that we've talked to you about in terms of the Stimulus Simplicity website. So please do not hesitate in any way, shape, or form to contact us today. And again, on behalf of the entire GE team, I want to thank you all for joining. We really appreciate it because we know how busy you all are. And with that, operator, I think we'll be able to adjourn the call. Operator, are you out there?
Ladies and gentlemen, that does conclude our call for today. You may now disconnect your lines. Thank you.